about what? Oh, about the tomorrow? This is the female side.
Yeah, the female side.
Yes.
No, the one they are here. You have the other one, the better ones. But it's with this.
Hello.
Yes, Viman.
Pardon? The main house?
Yeah, this is the main one.
Sorry.
You just mentioned it.
Doctor, the minute the car you pay borrow fee, mercy, Satan of you.
No, why am I at this? I understand.
He was very qualified dentist surgeon.
First dentist in Gambia.
First dentist in Gambia.
What were you expressing to Dr. Azedeh?
He said you should introduce and say this is this and this is
Oh, this is
formally, yeah, he wants
Mr.
to
in
do
charge.
formally.
We went on the advert.
How long have you been there?
Quite a long time.
About how many years?
I must check stuff. I must check it up. 1965 to 1900.
When did you come here? 1965.
Yeah, 1965. Yeah.
4 years now.
Yeah, yeah, 1965.
And I understand you was a dentist surgeon, huh?
Yes, I'm still in
The first dentist surgeon in the
Still a
Gambia.
dentist.
Yeah.
So why did you come here then?
The doctors come and sometimes they go leave their cargoes here and sometimes they will leave their cargoes there and remaining spend. So some of them when they do come they take us home. Some of them take us to our friends. We have homes in Banjul, for instance, we have home and there we go and spend the day or evening and whatever we have a child that we can go and never to come back.
Would you like to go home?
Yes, I would like to go home.
Yeah.
Yeah.
When have you been home last? When was that?
That's quite a long time, about 3 months.
3 months ago.
Yeah,
And you came back again?
yeah.
What would you like to see in Campama, Dr. Azedeh?
I can give a short history of Campama, and I can explain what we are trying to improve at the hospital here, and it depends what would you like to know about it.
What do you feel the people that will be watching this tape would like to know? What do you need?
I would like to mention it that this small house is a part of the main hospital, Royal Victoria Hospital here in Banjul. They are locating between 60 to 70 patients. Most of them they're staying here for a long time, the past 10, 20, 25 years. When I first came here and I saw the facilities here at Campama, and I just got the idea to do some renovation, some improvement of this hospital, to bring more comfort for the patients. So the whole building needed to be renovated again and to do some extension. The reason why we are doing all this voluntary job here and at this hospital is because as you have seen, the patients, they really need help. And whatever we can help this patient with, we a great deal with the patients. What we need in the first place would be a very qualified psychiatrist. We don't have a qualified psychiatrist here, and we have just 2 qualified nurses who are dealing with all these patients every single day for 24 hours. All the helps for they get the proper medicine and some finance. Maybe buying some buildings materials and just to be able to do the extension of this hospital. Just give a very short history of this house. And we just said that we are having a huge vegetable garden now.
Yeah, we have a
No, just wait.
we have a big vegetable
No,
garden.
wait.
Not now.
No, you just say something about the history of the
Of
mental hospital. How many patients do you have? And
we have 65 patients. How many meals? About 34, 56 meals. And the rest are female. That's all.
Now you use the vegetables and you sell those vegetables that are grown in the
We
garden?
use some in the garden, in the kitchen.
Right,
And we sell some to buy cigarettes and other things we need.
for the patients.
Yeah, for the patients.
And the other things that the patients require?
Yeah, sometimes we have buy things like soap, kitchen utensils like bowls and spoons, kitchen spoons and other
What are
things.
you the shortest supply of?
Pardon?
What do you need the most here that you don't have?
That we don't have. You're always in need of clothing, beddings. Mm, you need so many things, anything you can offer, really. We
Yeah,
always,
what is the most important thing you need?
usually we need clothing,
Right.
bedding. Um, if you can have some kitchen utensils like pots, plates, spoons, you need plastic cups. We haven't got cups and spoons at the
What
moment
about the
for the
medicine for your
patients.
patients? Do you have enough?
Well,
Do you have enough medicine for your patients, or you
well,
still are in need of?
we still need some more. We use chlorpromazine injection and tablets and Modicate injections we're using now. If you can have some few antidepressant drugs.
And what kind of qualified people do you need for the Campama, like
Well,
apart of psychiatrists himself?
well, if we can, we don't
And
have a psychiatrist.
we don't have psychiatrists,
And
but
we need an occupational therapy as well.
occupational therapy as well.
Because they don't do much occupational therapy. Just the gardening. Just gardening they do.
How many of these people can leave here if they want to? Or are they assigned here by the state?
Well, not really. We have few chronic patients that have been living here for so long. But most of them come for just a short period. Maybe 3 weeks or 4 weeks. Because we haven't got much here. The place is overcrowded. So most of them come as outpatients. They stay for 3 weeks, 2 weeks, have their treatment, we discharge them back to the community. And every month they come for their tablets or drugs or injections.
All right, we can.
Afternoon, morning.
So this is an occupational therapy of sorts.
As well. Yeah. Joe, I would like to thank you to be able to visit Campama, to film the whole evening, the charity party you have done it, and I felt you are very interested to see the life of in the Gambia, to see the health of the people in the Gambia, and I must say you've done a great job. And it's not only we would like to thank you for that what you have done, we would like to have contact from the Gambia to the place you are working, to the people you are watching your programs, that all the development coming up in the future, we would send film and then if you will be able to show the people. This is the reason why I have said before, whatever the donation coming in and deposit into the country, we make sure that people know exactly where the money goes and what we are doing with that amount of money they have spent it here. Now my question on you is, what is your impression of the health in the country?
The one thing that I've noticed is that I'm concerned about is the cleanliness of the people and also the willingness for the people to help themselves. I know you're not from the Gambia. Most of the Gambians that I've met are not concerned about their problems. It's outsiders that are more concerned. And the other concern that I have is the misappropriation of funds that are used. For instance, we videotape the locust situation. And we know that there is insecticide that's not even being used. It was supplied by the United States. All kinds of different aid that comes to this country that isn't being used for a specific purpose. So that's why I agreed to work with you, because I know that the aid that is sent will go directly to the patients that you're working with. and the people of Gambia. So my impression is this place needs a lot of work. The more, I would like to see things, cleanliness, somebody just going with soap and water and cleaning up, paint, and education. That's the most important things that I feel that are lacking. And making a patient more comfortable at a Campama, or even cleaning up and informing people for health practices in the Victoria Hospital is so important to the success of your mission here.
But you have just mentioned it, training. Training is the most important thing we should have here. If you have qualified people and disqualified people, they can train people however they wanted to have it. But I am not disappointed about all the project I have done.
Right.
Because they have seen it, someone has come to them, did everything voluntarily, spent his time, spent his money, and he asked his friends everywhere in the world to come and to help him and to develop this. And I must say, after 5 years working in the country and having all these projects, all the projects I have made, they are all clean, and the people that are looking after them, the places, because it is a self-help project, and they know this hospital, this health center belongs to themselves, and they have to keep it clean like they're doing their home as well. And it's very important to train them, to make them understanding this is yours, it doesn't belong to anyone else, and something belongs to you, I'm sure you are going to take care of it. I'm sure after development of that in the mental hospital, I'm sure that the nurses and people who are working there, they will take care of that area. We have already tried to improve it.
And I appreciate you spending the time, and also for your mission here. I think it's a great and noble effort, and I'm sure once the American people have seen your work and what you're trying to do, they'll help out as much as they can.
Thank you very much. Thank you.